There are many myths, misconceptions, misbelief, misunderstanding, confusions and contradictions regarding anorectal disease, especially piles. People consider any and every ailment, any disorder of the toilet as piles. They name it as piles. So irrespective of whether they have pain, they have bleeding, they have some mass protruding out, there is a pus discharge, they have pain while sitting, they have a pain while movement, they have irregular bowel movements, they consider everything as piles or hemorrhoids. But this thinking is absolutely wrong, irrational, because the symptoms of a rectal cancer or the cancer of the anal canal are quite identical to what the symptoms of hemorrhoids are. So there also you get painless bleeding, frequency of stool, some mass protruding. So if you consider these cancerous lesions as hemorrhoids or piles just because they have similar symptoms and don't consult an appropriate doctor, then you may lead in a trouble. So by the time the symptoms become so aggressive, the disease becomes so advanced, when you actually seek the opinion from an expert doctor, it's already late, and many a times it becomes difficult to provide you a complete cure. So please don't consider any or every element of anal pathologies as hemorrhoids. It's better to get checked, and once it is confirmed that it is hemorrhoid, then you are free to treat yourself as per your wish by different stream of medicines, whether it is Ayurveda or homeopathy or allopathy, whatsoever you feel convenient and comfortable. But please get yourself examined that you have the symptoms related to your hemorrhoids and there are no other severe and serious diseases inside. Many people believe that the anorectal disorders, or what they call as piles, is a disease of old age, elderly, and it does not occur in younger age group. But that is not correct, because there are so many diseases of the anal region which are congenital, which are present right from the birth. Few other anorectal problems could be in a children, like they may have fissure causing pain, bleeding, burning sensation. They may have a mass protruding out during passing stool, which is called as a rectal polyp. They may develop abscess, that is swelling containing pus, or it may burst to cause fistula. They may have toiletry disturbances in the form of passing very hard, very painful stool, that too after 2 or 3 days of time. So similarly, there is one disease called as a pilonidal sinus, where there are multiple openings on your back at the lower end, which is a disease of youngster, mainly the teenagers, and almost 95 to 96% of this disease occurs only in teenagers and young adults, where it does not appear in the elderly. So the belief that this will not happen to young age group, it is a disease of elderly, is not quite correct. So anorectal diseases don't spare any age, any sex, so they can occur anywhere and everywhere. Many a times the question is asked if there is any direct relationship with our eating habits, with our digestion, with our gastrointestinal tract and the anorectal disorders. So it is absolutely true, because your anal canal is the end part, the last one of your gastrointestinal tract. So any abnormality, any disorder, any disease of the gastrointestinal tract, maybe it's stomach, maybe your small intestine, large intestine, all these, if they suffer by some or other disease or disorder, they can reflect in some or other form of anorectal symptoms. So it's always better that if you want to get rid of your anorectal issues, you better keep your digestive system in a correct order. If your food contains too much of chilies and spices, if you don't eat regularly on proper time, if you have a disturbed sleep, if you are eating hurriedly, if you are consuming too much of carbohydrates, especially the refined flour, which is called as maida, or substance made from it like pizza, burger, or bread, etc. So these are all constipating substances which get stuck into your digestive system, doesn't pass out smoothly, and then they themselves can be precursor of your anal diseases, especially fissure and hemorrhoids. So you might have noticed that when you eat too much of chilies or spices, next day you feel burning, sense of heat, irritation and itching at your anal area. So your digestion, your food habits, your dietary constituents, they all have a direct relationship with your anal canal and its disorders.